ground us in why are we here? We're here to support each other and showing up for gender expansive and LGBTQ plus youth. And I think to start off really importantly, we have to hold two truths. And this is important for parents who are coming into your offices of any kind. One, there are distinct struggles and anxiety and depression, and we'll talk about that a little bit, for kids navigating these journeys. And knowing that and being aware of that helps inform us, helps us really tune in and pay attention. It is equally true that there are happy, healthy, thriving, creative, amazing gender expansive and LGBTQ plus youth and their parents. So when we emphasize the ways that kids in this path struggle, we need to until the numbers change. But we also want to remember as a group that it's not inevitable. It's the social pressures, it's the lack of affirmation and understanding that create elements of the anxiety and depression. And that it should go without saying, but I'm going to say it anyway, that there are scores and scores and scores and scores of healthy, happy, thriving kids in community. So a quick note for folks who are, because I know there's medical and other folks here, you don't have to be the specialist. If you're a pediatrician, if you're a medical provider working with kids and families, if you don't have to be a specialist and know it all right away, but pediatricians are often the first place, in my experience, that families show up and either kids are trying to get the pediatrician's attention or parents are wondering what to do. So pediatricians or points of contact within medical care systems are a really important place of interface with young people and their families. SOGI. SOGI is a word that I use a ton, and that is because it refers collectively to a person's sexual orientation, gender identity, and gender expression. And I specifically use this word, and you'll hear me talk about SOGI-related issues or SOGI paths or things like that, because we all have one. And I also think that's important when we're doing trainings. This isn't a training about those people explicitly, right? That group of others who are so foreign for me that I don't relate. It is a training that recognizes as humans, we all have a development. We all develop information, get clarity about sexual orientation. We all develop a gender identity. We all develop gender expression and make choices around our gender. Currently, the statistics show us, and we're going to talk about some stats, 9 out of 10 people have an alignment in terms of their gender identity between their head, their hearts, and their parts. So that's language I use a lot with folks right off the bat. I say in the old days, especially talking to kids, and I've got some scripts in here, we used to think gender was in our parts. Now we know gender is in our head and our hearts. Sex assigned at birth is what the doctor shouted out, but your gender is in your head and your heart, not necessarily limited to your parts. So 9 out of 10 people these days, some of those stats are changing, but for now, are identifying as cisgender, which means they feel an alignment or a congruence between head, heart, and parts. Transgender folks are letting us know that there isn't congruence. Their experience is that there's not alignment with what their head and heart and parts are doing. And it's an example of biodiversity. It's been happening throughout time in cultures around the world since the dawn of time. Western media may be paying more attention to it recently, but it is not a new phenomenon. We'll talk about some of the stats. So it's also here to stay. So if you're noticing that there's this myth circulating that it's a fad and it's showing up in your office but won't forever, notice that, because actually what we're seeing consistently is that younger folks, as many as 12% of millennials identified as feeling gender non-conforming or gender expansive or transgender. And then some of the most recent data that came out in a different study said 5% of adults under the age of 30 are saying not just gender expansive, but transgender non-binary. And that's 2% identify as trans men or women, and 3% are non-binary. So very quickly, it's always hard to know exactly where to land with language in some of these trainings. If you're hearing somebody say transgender woman, woman is the identifier you need to pay attention to. That's telling you this person identifies as female. They're a transgender woman. Transgender man, Man, that's what you're paying attention to. They're identifying in their head and hearts, and we don't know what state their body is in. That doesn't matter. What their head and heart is telling us is that they're transgender man. So you're listening for that second word as the qualifier to help you keep that straight. Non-binary folks, that word specifically refers to people who don't believe that those two boxes of man and woman capture their gender, don't want to be pushed. They do not want to be pushed into those categories of two. So they are people who describe themselves as feeling elements of both masculine and feminine energy or neither. So they're not going to be pushed into a box around this stuff. So they non-binary is the word that refers to folks who feel both masculine and feminine energies or neither. Stats that are important here are, this was the stats that I was talking about at the beginning, in terms of knowing that even in this day and age, because I hear a ton from people, especially well-meaning cisgender heterosexual friends of mine who say, oh, everybody's bi. My kid tells me that everyone is bi at school. The kids don't care. It's not stressful for them. And yet I spend all day working with kids who are pretty stressed out navigating this identity. We still see statistics. This study is getting a little bit older now, but it was a hallmark that if kids in their families and their caregivers around them are blamed, shamed, excluded, name called, they're 8 times more likely to attempt suicide, 6 times higher levels of depression, and 3 times higher levels of at-risk behaviors that I think are really shame-based. However, if family and caregivers, and that's why I center a lot of my training around family and caregivers, require respect, show support, express affection, and advocate, then we see higher self-esteem. Those symptoms of anxiety and depression are no different from the broader population. They believe and look forward to a happy adulthood. So helping caregivers get informed and affirming is critical in the wellness for gender expansive and trans kids. Another study just shows that really quickly. You've got these slides, you can look back at them. This was 2012. There are more and more studies coming along recently. If transgender youth felt supported by their family, they were reported positive mental health 70% of the time versus 15% without it. Much less likely to attempt suicide, and normalized rates of mental health concerns with caregiver affirmation and support. There's a recent phenomenon in the media that is specifically, you hear a lot of language from folks that all of a sudden there are all these people who are assigned female at birth, in particular, who don't identify as female anymore, and who are flocking away from femaleness and identifying as trans boys, trans guys, and that this is really new, and it's out of proportion, and it is really worrisome. And yet somebody just recently did a meta-analysis and saw that it's still in gender clinics and folks responding to surveys, 91,000 adolescents, we still see rates that are higher for folks assigned male at birth, slightly higher for folks assigned male at birth. So I just included this because there's a lot of talk in mainstream media. I don't know if any of you are familiar with this book. Parents may be coming into your offices talking about a book called Irreversible Damage, written by a psychologist who interviewed parents. And they said their kids all had this rapid gender dysphoria, that it wasn't based in reality, that they were told they could have hormones. It's sort of become this, it's become something that many parents who are afraid, many parents who don't know quite what to do, have sort of turned to this. It's getting a lot of media attention in more conservative corners around gender, and it's coming to my office constantly. So one of the premises is that there's all these people assigned female at birth who are flocking away from femininity. It's because we're not doing a good job of teaching girls to be proud and not be honored in our culture. I wouldn't disagree with that as a strong feminist myself. However, it's not fair. Like, so much of the time, there is all this energy spent on inaccuracy. It is not accurate that there's this huge wave of folks, way more people assigned female at birth than male at birth, who are questioning their gender. This I thought was an important piece of data. I also hear people in Hawaii say, well, here we don't, Hawaii's not a bad place. It's okay. It's an okay place to be navigating these journeys. People here don't typically bother each other that much. Everybody has a cousin. We get this right a lot more than other places. And indeed, that I can't argue with people's lived experience around that stuff if they're talking about their firsthand experience with it. But the Trevor Project this year, 2022, did a survey and found that 40% of LGBTQ youth who are Asian American or Pacific Islander, and this was not only limited to a Hawaii sample. So they were looking at Asian Americans and Pacific Islanders in different parts of the country, have seriously considered suicide in the past year. Native Hawaiian youths, Pacific Islander youths, were the highest rate at 49%. As you can see, they're followed by Korean American or Filipino American. So we may get some things right, culturally, collectively, and I haven't seen the breakdown of exactly how many folks were Hawaii based. I don't know if they did it, but since many of us who are here are working with AAPI population, we're not out of the woods with this yet. Again, I hear so many well-intended people say that it's so much better. And in many ways, it may be better than kids navigating this many years ago. But we, broadly speaking, the way I describe it to folks is that there are a lot, in my humble estimation, there are a lot more people who understand the importance of advocacy, who understand, who think broadly about gender, who are learning more about transit. There are more allies, more people learning more and wanting to know more. But there's also a really strong undercurrent. There's the most anti-transgender legislation that there's been in the history of our country in legislature nationwide right now to limit rights, refuse access to bathrooms and medical care. So while we have a growing groundswell of advocates and allies, we also have a pretty strong thread of folks challenging progress in this direction. And the experiences of the kids on my caseload in Hawaii are very, very much sort of mirror that, right? Most people leave them alone, quote unquote, but there's always a thread of folks. It's still very difficult to navigate most spaces, public spaces these days. So what we know about caregivers, this is a whole other training that I do, but I'll say quickly because it's super important. Most of the parents that I know believe that what they're doing when they're trying to change their child's behavior, or not that let them wear certain clothes, or wanting them to follow these gender rules that are so clearly prescribed in our cultures, various different subcultures, that they're protecting their child from harm. They have a belief that if they can wait out some of this gender questioning or make their child conform, that it will actually be easier on their child. And in fact, that's not the data that we have. The data that we have says the single most protective thing that caregivers can do is explore with their child, get informed, and seek support, because affirming an identity is critical to wellness. Does that mean that every single kid who has ever said, or whoever kid whose child assigned male at birth and plays with dolls is going to be trans? No, it doesn't. There are a subset of kids who explore and end up identifying as cisgender and heterosexual. There's another subset of kids who explore gender and end up identifying as cisgender and gay or lesbian, or have sexual orientation diversity. And thirdly, there is a group of kids who do explore gender and then continue to persist and identify as either transgender or non-binary. And so the single most protective thing caregivers can do is work with their child on a path toward clarity and support, and find the expert support they need to take steps to affirm and protect. And I talk about the parent emotional journey as a river. That's the other thing we do, is we push parents into a binary. We say parents are either rejecting, and that's really bad news for kids, and we better get those kids to a youth center and we can't expect these parents to be accepting because they're of a certain race, of a certain class, of a certain religious faith. And so we would separate kids and get them support. Now we need to support kids. We need to get them their support. Absolutely. But then we wouldn't work with these rejecting families. Similarly, when we have parents that look affirming, right? Everybody says, oh, they're okay with it. The child can live at home or something like that. And then we would just say, oh, lucky kid, and leave that family alone too. Whereas what I find in my work is that the kids are healthiest when caregivers are informed that caregivers need their own space to figure this stuff out, and that they very often experience this path as like a river. There's some straightaways, there's smooth flow in some part, and then you hit a whirlpool, you get sucked under, you may hit a dam and stop. It's a process. This isn't an event, it's a process for families. And that very often they will experience fear, guilt, grief, all of that. Fear about their kid being rejected, teased, harmed, having a harder life comes up. Fear that they're going to lose family members and relationships with churches and community groups, and they often do. So a lot of these fears are valid, and parents hold them dearly out of worry for their kids on a bunch of different levels. Guilt about things they said before they understood it. Guilt about what the church has taught them or their culture of origin would be saying about this kind of stuff. Guilt for the times they tried to change their child's behavior before they understood it. And grief. Grief around the loss of their expectations. I loved sharing these certain things with my mom, and I assumed when I had a child assigned female at birth, I was going to get to share them. But now that I have a son, that changes everything. Losing relationships, losing community, losing safety, losing privilege, recognizing there are places that are not safe for your kids in the world, and maybe not vacationing the same spots, not belonging to the same community groups. There's loss. When I first started talking about this with friends of mine who are parenting trans kids are like, it's so great that you name that. It's oversimplified to say you're either rejecting or accepting. Even the most accepting, affirming parents have fears, have guilt, have grief. They worry about it. So I'm so glad you're naming that, because it's really hard to find places that it's okay to say, I'm scared for my kid, or I'm grieving what I thought was going to happen in my life, but I'm not grieving my kid, knowing their path and their courage. Thank you for saying that. And holy cow, you can't leave it there. You can't stop without talking about how amazing the part of the journey is when you've established a line of communication with your kid, when you've walked through fire together. I have conversations, this is friends of mine saying, I have conversations with my trans kid because we've had to practice them. We've had to figure out how we're going to do stuff. I have conversations and connections with my trans kid that I wouldn't have had if this wasn't a part of our family's life. And so don't you dare only focus on the grief and the hardship parts. You got to talk about the hope piece too, if you're going to talk about the parent experience. So I do want to talk about all that, but my experience as we hear in mental health is if you don't hang out in some of the fear and the guilt and the grief and give caregivers a space to be okay asking questions, to have their judgments and biases and myths and to meet them where they're at and move them along, then we can't get to the hopeful part. So what does this mean in the office if you're a provider? And I know I am dashing through a lot, but we want to be able to, talk about what it means in the office and some scripts and stuff. So to oversimplify into do's and don'ts, what I hear a lot, and then here I can, let me stop really quickly. Are there any questions right now? I'm looking at the chat. Yes, okay. To see if there's anything, and if anybody wants to jump in now, that if cases that affect you negatively. So yes, Geraldine, if you do want to say a little bit more about that to clarify, I might make an assumption that what you're talking about is if people's biases, you mean like the biases that caregivers hold? Okay. Yes. So your own positionality to this issue can also be tricky, right? If you are parenting a gender expansive child yourself, or if your sister is trans or non-binary, or if you yourself are trans or non-binary, or identify as somewhere in the queer community, sitting and listening to other people make statements that are dehumanizing, or that show a complete lack of understanding of how gender and sexual orientation work, is likely to be upsetting and triggering. And so I think knowing your own limits around that kind of stuff, I try to come at it, and it's easier for me. Again, you've heard my positionality in some of this. I try to come at it from the standpoint of, if I can move these caregivers, this kid benefits. If these caregivers feel supported by me, they're more likely to move with me. And again, depending on your role, if you're a mental health person who's treating this family long-term, then you're more likely to be doing this walking. If you're a pediatrician and you're catching this in your office, we'll talk about that too. So for the beginning phases of what to do and how to do that. And I try to remember that most parents, flawed or not, are trying to be protective, and that most parents have been fed the same inaccurate information that we all have. They've been raised in the same gendered world. They don't have the benefit of the privilege of the knowledge that I've had through my life experience and schooling. And that if I can find a way to connect with the part of them that is worried for their child and wants their child to succeed, then I'll have a better chance of figuring out how to move it along. But it doesn't mean it's not going to bump up against your identities and that you don't need supports. Statistics on violence and abuse within LGBTQ relationships, I do, but not off the top of my head right now. What I will say is that it is underreported. I'm looking at another question here with somebody asking about that. Statistics that domestic violence is underreported in LGBTQ communities because of how often interface with helpers is not helpful. So very rarely folks want to open up their relationships to police, to other providers, because they've experienced so much bias when they do. So I would say that what we know is that the statistics are underreported, and relationships are relationships. So there are people who experience significant stress and act out with violence and aggression, with the added minority stress strain on top of that, and the added hesitation about seeking support from systems when those systems have not always been welcoming or supportive. So all right, I'm going to jump back in, and hopefully it won't take me as long to share my screen this time. All right, giddy. Okay, so knowing that we have a mixed audience, I do want to say a little bit in here about the medical pieces, or if you're in your office and you're not going to be the ongoing therapist, or even if you are, it applies to everybody. What parents have explained to me happens quite a bit is that either folks interfacing, pediatricians will either say very little, just sort of nod as if it's a symptom related to sleep or food or whatever, but not pursue further with questions. And I think a lot of that has to do with our own comfort about how do you talk to a 4-year-old around this versus an 11-year-old around this. The parents in the room, are they not in the room? Like, how do we actually get data? But what families and kids are experiencing is no further questioning, or somebody jumps in and says, oh yeah, lots of kids explore. Oh yeah, you know what, I used to play with dolls, or I used to play with trucks, or they use a personal anecdote and sort of talk about it as a phase. Or, oh yeah, my daughter says half the 7th grade is bi or non-binary these days, and assume that this is a phase or a frivolous exploration. And it shuts down the opportunity for parents to get help and for kids to actually be able to assert themselves in this situation. One of the other things that happens is that parents themselves also, when you talk to parents about having a child who is saying, I was assigned female at birth, but I'm telling you that I know in my head and my heart that I'm male, worrying adults, whether that's care providers or parents, often race right forward to surgery and hormones. And I know there's going to be some other presentations in October on the medical wing of things about some of the more details of the medical pieces around what do medical transitions look like, what do medical interventions look like. But in my experience, if parent worrying brain races right toward surgery and hormones, and if medical providers mirror that in the first day and start talking about, oh, they're too young for hormone, or they're too young for surgery, then that freaks everybody out. And now you're dealing with a panicked parent, and you're not actually gonna further the conversation and get them to learn. There are many non-binary and trans young people who never ask for medical interventions. Some ask for hormones, but no surgery. Some don't want hormones or surgery. Some want a name and pronoun change. Some do not. There's no set formula for what having a non-binary or trans kid means you will be asked to do medically or as a parent. So staying open, remembering that, not jumping ahead to hormones and surgeries right out of the gates is really important. Meeting this family where they're at, what their questions are, asking a child what they do know, and what they're thinking about and what would be helpful for their gender. And we've got some scripts here to talk about it. We see clinically, there's sort of two tracks of kids. There's a track that we call early disclosures. And they're those kids that you see more and more media about a while ago in particular, who are from the time they can talk, from the time they're 2, 3, 4, they're like, no, mom, I'm a girl. Why does everybody say I'm a boy? I'm a girl. Mom, I'm a girl. And in some ways, those are easier situations for parents to wrap their mind around. In some ways, it's still, a lot to learn for parents. Then we have later disclosures. Puberty, the onset of puberty, is another common time for kids to come forward and say, something is not in alignment with my head and my heart and my parts. I've been thinking about this a lot. It's also a time when we're more suspicious of those reports in a way, because we're like, is this coming from TikTok? Is this coming from that group of kids in the 8th grade? Is this where is this all coming from? And yet we know that as puberty begins and the body starts to change and secondary sex characteristics start, that it's a trigger. It's a point at which many children recognize something's not right. They're also cognitively old enough now to be able to say something doesn't feel right. It's not lining up. I thought everybody felt the way I did when I was 7. I didn't know how to put this into words. Now I recognize and I can tell you this. So for a variety of reasons, cognitively and bodily, puberty is another time that we see kids come forward and say, this is real. I need attention to it. I don't feel good. And we have to pay attention to it rather than dismissing it as adolescent frivolity or a trendy thing. We have to dive in and take a look at what's going on for this kid so they can get the help they need. Also, being mindful of if a child wants to talk to you and mentions this, it is something that ideally you have consent, that you talk to the child and say, I think this is an important piece of information your parents have. Do I have permission to talk about it? It isn't the kind of thing that you then walk out, into the lobby and tell both parents unless the kid knows explicitly that you're going to do so. Because sometimes kids do want to talk to their medical providers or mental health providers in confidence while you team together to imagine how to include parents in the conversation, right? As you know, sometimes it's coming into your office from the parent, sometimes it's from the kid, but you want to be mindful of not outing a kid to their parent before they feel ready to have joint conversations. That's an important piece of our work. So what can you do if you are in an office setting that receives any human into your office? Does the sign-in paperwork say male and female as the only 2 gender identifiers? Do you have flags and safe space zones lying around and visible to other people? Do you identify your pronouns when you introduce yourself to people? All people, not just people you think might need to hear your pronouns, but all people. do you have a place where you can say, you know, what's your prefer? Oh, hey, do you have a nickname or a preferred name that you use? What pronouns do you use? The more normal you make these habits and patterns, the easier it is for folks to communicate. In my experience, folks who aren't having gender related needs will just sort of be like, what? My pronoun? She, or, you know, I go by her, hello. And you can say, oh, I just don't like to make assumptions. So I ask everyone. So when you do actually ask everyone, you can legitimately say, oh, I don't like to make assumptions. I just ask everyone. And if kids are on a gender journey and they hear an adult asking them about pronouns, it's an immediate lighthouse. It's an immediate beacon that this person has at least some idea and may be a safe person for me to discuss what's happening. And then also, again, I would say, you know, making time to ask teens privately around gender related kinds of things is important to be able to say. And we're going to talk about how to do that. I threw in some scripts, just figuring let's make it as practical as possible. Although there's always, I mean, if people really do want more in-depth trainings about it, then I'm happy to chat about it. But for younger kids,
Dr. Anderson, before you move on, can I ask you a question that's from the chat?
yeah, please.
Geraldine has a question and says, how do you keep an open-minded approach with parents who clearly display their dissatisfaction with their child's view, especially when the child is clearly expressive about their feelings?
Yeah, it's hard. It's hard. I think what I do is I just go, again, I go to the system stuff. I try to imagine that parents are afraid. I try to imagine that parents feel responsible for teaching gender and they think they've failed. I try to imagine that parents may be embarrassed, that parents may be blaming each other, because society blames the parents initially too. Uninformed society blames parents. Lots of parents of gender expansive kids are hearing from other adults in their world, oh, you know, I wouldn't let, so the message to parents is you either created this, or at the very least, you're allowing it, and something's wrong with that, right? So parents come in feeling under the microscope, judged, having failed, afraid, anticipating loss, which may be very real. So I try to keep the parents in that, it like fear does funky things, embarrassment does funky things to us. So I try to stay in there. That doesn't mean there have been really hard days where I'm very sad and I need to reach out to a friend afterwards and connect with folks and squeeze my kiddo and just you know, try to really reach deep around how ugly that it can get sometimes when people really don't, when people aren't opening to examining a worldview that they've been very methodically taught. And that's how I think about it. This is programmed. So I don't know if that helps, Darren, but I try to remember, and the parenting experience is intense around it. That's not to compare it as hard as, I'm not getting into the Olympics of who has it tougher in the situation, but parents are under a really distinct pressure in this situation and carry a lot of judgment as well. And yeah, and I think too, if you think about like locally, if you're a person, I mean, it's not a really big locally held value to call a lot of attention to yourself, to have your kid calling attention to themselves, you know, so there's a lot of nervous, embarrassed parents who come in feeling that they've failed somehow. They also feel out of their depth once they start learning about this. They're like, I don't know what the, I mean, so it's really unsettling, even for affirming parents, let alone the parents who are having the worldviews that have to make the biggest leaps. It can just be really, really scary to have to figure out how to do this, because it does mean having hard conversations with school personnel, grandmas, clergy members, bus drivers, right? Like it really makes a lot of things that are normally private pretty public. And that's not comfortable for lots of folks. So I try to keep that in mind when I'm holding parents with a little bit of grace, all the while expecting them to move. I mean, it doesn't, because I am understanding that parents are in a tough spot, I'm not excusing flagrant abuse. I'm not, you know, saying, oh, I'm not excusing any of their behavior. I'm explaining it to myself and hoping I can move it along. So hopefully that helps in terms of how I think about it. So And I know we're covering lots of ground. I'd be happy to come back another time if there's fall already. I'm like, oh, I could say this or that. But I think one of the things that's important for folks to know in the moment. So if we don't want to dismiss the conversation outright, if we don't want to write it all off to lots of people play with this kind of stuff, then we can think about ways to have these conversations. And the language that I find most effective with younger elementary school kids is exactly the one I've been using already. Like, you know what? In the old days, we used to think gender was in our parts, right? When you were born, the doctor held you up in the air or whatever, looked at you and said, aha, this is, a girl. They used to think the gender was in our parts. But now we know it's in our head and our hearts. Those parts don't tell the whole story of our gender. So in your head and your heart, do you feel like a girl, a boy, neither or both? And many young kids can tell you that if they're clear already. And again, for cisgender kids, they'll be like, boy, whatever. And then it just sort of rolls over their head like, that was random. And it doesn't cause distress for children that this is not resonating. If you're really casual about it and you've practiced having this conversation, it won't be clunky and it won't seem odd. Like I ask everybody, just check in. And then similarly, you want to get a little bit of a reading with the younger kids of how much distress they're in. There's a little bit of a sweet spot, to be honest, between the ages of like 3 and 4 and 10 or 11 going into puberty, where if kids are in places they can transition safely and be supported, schools can make room for it and figure it out. And parents aren't tasked yet with the medical decisions, because if they have a child who wants them, because they're not into a zone where you would make medical decisions yet. So you still want to find out how distressing the conversations around gender are. So, right, like if your gender does feel different, or if you feel like both a boy or a girl, is that something you feel great about? Is that something that's a little upsetting sometimes? Or do you have big feelings that are upsetting a lot about this gender stuff? Because gender can be confusing for people, right? And so are people around you confused? I use the word confused a lot. I will say, well, so tell me, what do you think? Do you do things that are unexpected for a person that people think is a girl? Like there are ways that you can talk about unexpected choices, and having confusing, like do grown-ups or other kids get it confused? Like, oh, there's those old school rules again, teaching people this is how we ought to be dealing with kids and gender. I'm so glad in our family or in my office here, we really understand that those old school rules just don't fit anymore, that there's all kinds of different ways to do gender. So these are ways to assess with kids whether or not there's something going on for them. And you can do it with kids from very, very young ages. So just to give a tidbit too, again, with the older kids, similarly, right? In the old days, people used to think that your private parts put you in one of two boxes. Now we know it's more interesting and complicated or complex than that. How do you identify as a boy or girl, both or neither? And allow kids the opportunity to respond to you around that. And then we also, one of the other things that comes from this work in the world of gender is we can get a lot of information from asking kids when they're gender euphoric as well. When are the times you feel happiest in your gender? Because that will give you information. Oh, and I'm with my friends because they use this pronoun, and I change clothes after I leave the house. And so I'm in masculine clothes and my friends are using this pronouns and it feels great. Or I've had kids say before, the other day I was in Starbucks and somebody called me ma'am and they lit up because a stranger gendered them in a way that felt right to them. That will give you some information about what's resonating with a child. And then when are the times that it's really stressful? And then how stressful is it? Is it like super stressful, kind of stressful? Because we know that kids on this journey are much more likely to have depression and anxiety and suicidal thoughts and attempts. If they're not being supported, we want to make sure that we're assessing for, what level of upsetting is this to you? So some important things to keep in mind. So why do we need to know? So, and we'll see I have a multidisciplinary slide here. If a child wants and needs medical interventions, then it's important to know what stage of puberty they're at. I also want to say very clearly, and you saw this in one of the tests, I've supported families for kids who really, really needed the medical interventions to truly feel settled, to feel safe, to be aligned. I've worked with teenagers who needed that. I have also worked with other teenagers that were like, nope, I don't really need that. I just want names and pronouns. I'll get to that other stuff later. I've worked with kids who probably needed it, but whose parents were not going to say yes. I've supported those families too until they're 18, and supported the kids with coping if they weren't going to get the medical interventions. So sometimes folks think if kids are coming to a gender specialist, they're always going to get a medical intervention, or every kid that says they need medical interventions, we're like, oh, okay, sure. There are multi-layered steps to getting kids medical interventions. Mental health professionals have to write letters for insurance companies and for a lot of the specialist clinics. Family has to have fully informed consent. I do family meetings where we discuss all of the side effects and the outcomes and get parents to say they've seen all that stuff. Like, there are layers and layers and layers of assessment that go into starting medical interventions, and some kids don't need them. And if some kids are having florid mental health needs, then we're cautious about decision making and how things are done. So it isn't that any gender expert always rushes kids to and through a medical change or rubber stamps a yes. We're looking at decision making, we're looking at role in the family, we're looking at other mental health concerns, not as a reason to stop medical interventions or refuse medical interventions, but to understand a kid in their whole context. And are they able to make decisions and truly provide assent, and their parents provide informed consent. So we consider other factors in their diagnoses, if they have an autism diagnosis, if they have a bipolar diagnoses, if there are other things going on, doesn't negate the ability to get gender affirming care, but it helps us think about the ability to assent and social supports and decision-making timing and all of that kinds of stuff. So we do also want to know in our assessment in our offices how much distress they're experiencing. Do they have requests, right? So when we're talking to kids, okay, so you're saying this, you are feeling, like a boy, not the girl you were assigned at birth. Do you have requests? Would you like people to use a different pronoun? Would you like who's getting it right? Where do people get your gender stuff right? Where can there be changes? You're also asking yourself if family have support. And we put in the chat, one of the things I hope will be most helpful from today is I pulled together a bunch of books for young kids, books for old kids, resources for parents, latest research links on some meta-analyses in Psychology Today, and Cornell University has like 77 studies where they looked at gender affirming care. Local Hawaii-based, if you happen to be in Hawaii, affirming churches and other affirming resources. So does the parent have support? Resources are really a great place to start with folks. And then also, are the parent and child open to seeking consultation from a specialist who can help them understand their child's experience of gender and help make decisions if there are decisions to be made for young people and their families. Most importantly, you want a kid to leave that office. I'm watching time, dashing quickly. You want your kid to leave your office feeling heard and understanding that we can respect this as an exploration without making it sound like it's frivolous. So what do we need to learn? We don't have an outcome in mind. We want parents to understand that we can get them some support, that this is a path that the whole family goes on and needs to learn about. And we're not going to make any assumptions about the outcomes, but we want to figure out how to get them some help to get some clarity. Clarity is a great word I use all the time. And then have these national, local resources available for families in your office. Oh, I also say here all the time to parents and kids down here, look, I'm not an accelerator. I'm not a roadblock in your child's journey. I'm not doing either. I don't have an outcome in mind. We need to walk on this together, work with this together, communicate clearly as a family to get to what your child needs so that they're not part of those statistics that you've Googled right away and are really scared about. One last quick note, doing nothing is doing something. If you have a child who has a lot of distress about their body and identifies as trans, and they are going to go through 4 more years of puberty in their sex assigned at birth, if they were assigned female and they're going to have estrogen in their body for 4 extra years because people were saying, we'll just wait and see, well, what, that's doing something. Doing nothing is actually impacting their body's development if they're ultimately going to end up with testosterone in their system. And I'm sure the other folks you're going to talk to next will do more of the medical piece, but the wait and see approach is actually doing something for kids if they're not getting the assessments and the help that they need. And we want to be able to support parents because youth fare much better with family support, and that not getting this rider has implications for mental health, physical health. There are implications for fertility in terms of the timing of these interventions or whether or not kids get them. And also the number of kids who are in our schools right now, completely distracted by what we call gender noise. They're not available for learning if they're not in their own bodies and comfortable and feeling supported. So if you're part of a multidisciplinary team, pediatrician will track the Tanner stages. These, if you're going to block hormones or block puberty, Tanner stage 2 is ideally when that happens. Mental health professionals will do assessments and provide services. Mental health professionals write letters for insurances, or for like the Dr. Pia at Capilani needs letters written as well. And there are local specialty clinics if you're in Hawaii. Dr. Pia Francisca, I hope I spelled that right, Natuan, and the Lavender Clinic. And on that list of resources that I put in the chat, there's also a list of the mental health providers that I know who are known to specialize. That number is growing. I hope it keeps growing. We don't need to really talk about that. So yeah, we want to reiterate that kids and families can provide informed consent and assent, but also gets people insurance coverage too, when the insurance companies get a letter from us saying this is legitimate. Other resources here, there's more in your chat. Oh, there's how to find me. I want to make sure that we have time to look at, and I'm so glad to hear other folks are coming in, and there's a lot to learn. I've been practicing now for 25 years, and I've done a lot of little, like, oh, I can do some anxiety stuff and I do this, but the gender piece really calls for specialization and training. There's a lot of intersection of child development and gender. And so I do some other Facebook chats, and I have a newsletter and it's free stuff that where I talk about this more and more around folks. So there's lots of ways to get more information, because everybody comes in with different levels of exposure to these concepts. Are there any questions? And I hope those are important takeaways. Again, I know with a wide, some folks mental health, some folks pediatrician, some folks with some experience, some folks with none, some folks with a lot. Hopefully the conversation, the idea was giving folks the imperative to be able to access resources, to know some of the local stats, to combat some of the myths that are out there about the people assigned female at birth, and also just this sense that it doesn't matter now. I hear a ton, and my caseload's full with a lot of kids who are struggling because the rest of us haven't figured this out yet. And I know it's complicated. Overlap of child development, mental health. I know it's complicated. It's specialized work. So I'm really grateful when folks want to learn a little bit more about it.